The COVID-19 pandemic came first, and I think the greatest challenge we had there was the uncertainty of things. It was new, there were some gaps in the science, and the science was growing as we were, responding to the pandemic. So that was something I think that was significant. The volcanic eruption was, a totally different story because, that just came and we already had people displaced because we've moved people from one vicinity to another, from one public health function to another, and suddenly now our staff were under threat. So the people who I had who live in the north, my staff, my nurses, doctors, and community health workers, we had to not only have them continue working, but also to make sure that they were safe, to make sure that they were evacuated safely, and that the families were looked after while they were able to continue to work for us. And so that now having people in shelters and trying to deal with the COVID pandemic, we know is the COVID spread in shelters. So again, having the public health surveillance in shelters was extremely important. And when you add dengue to that again, that was even stretching our public health resources really, really, really thin. But we coped, and I think primarily because there was strong political leadership in the country in the response to both the pandemic, the volcanic eruption, and as well as the dengue outbreak. So that political leadership with regional help from our regional partners, particularly the Pan American Health Organization, and to some extent the CARICOM also, that we were able to respond.